Medicare Annual Enrollment versus Obamacare, Marketplace, or ACA Open Enrollment. What's the difference? Let's dive in. So, Medicare Annual Enrollment versus Marketplace, individual healthcare, Obamacare, ACA individual enrollment period. What's the difference? A lot of people become confused about what rights they have in each one and how they function, especially when they transition from individual insurance under 65 to Medicare over 65. So let's go through that now. The Obamacare, Marketplace, Affordable Care Act, healthcare.gov, individual insurance, they're all terminologies for the same thing. Right? It's individual health insurance for those people typically between the ages of 19 and 64. That individual health insurance has an annual enrollment window between November 1st and January 31st. Again, that individual healthcare enrollment window runs between November 1st and January 31st. Any enrollments made between November 1st and December 31st will start January 1st of that following year. Any enrollments made between January 1st and January 31st will then start February 1st of that following year. In the individual marketplace, this is when you get a chance to review the plans for the upcoming year, make a change if you're not satisfied with your current plan, and reevaluate your subsidy if you get one. Most people that participate in the individual marketplace are given a financial subsidy to make the plans a bit more affordable, and this is the time of year that you recertify that, especially if your income's changed. You don't want to assume that everything is the same and then have to straighten up at tax time with a large tax bill because you didn't update your income during this time of year. So during this annual enrollment, not only can you choose a new plan, but you can also update your income to make sure the plan prices reflect exactly what you should be paying. There are no health questions that come into play during this open or annual enrollment period for individual insurance. You don't have to answer anything really about your health except for gender and smoker status in most cases to determine if you qualify for a plan. And they can't deny you for having health issues. This was one of the biggest and most important pieces about Obamacare or the ACA is that it allows you to join a health plan without any health questions for pre-existing conditions. That wasn't always the case. There was a time when insurers could charge you a lot more or tell you that they wouldn't give you insurance whatsoever if you were sick. A lot of times the term Obamacare or Marketplace has a really poor annotation. All that means is that one, they can't deny you coverage, and two, if your income is under a certain level, they'll give you the exact same plan that you could buy privately just with a government subsidy. For example, if you wanted a Blue Cross Blue Shield Plan A, you could buy it privately directly from Blue Cross Blue Shield, or you could buy it through the Marketplace, Obamacare, healthcare.gov, and get the exact same plan at a subsidized rate so you're not paying the whole thing. So this annual enrollment period for people between 19 and 64 runs from November until January 31st. You can join any plan you want, update your income to get updated prices, and they can't ask you health questions for what you're doing. Now, this is a little bit different than the Medicare Annual Enrollment period, which is for people over the age of 65 or typically under the age of 65 on permanent disability that have been granted Medicare. The Medicare Annual Enrollment period runs from October 15th to December 7th, and all plans start January 1st. So the period runs a bit earlier, and during the Medicare Annual Enrollment period, we have another video on this that you can watch for more detail, but you can change your prescription drug plan, you can change your Medicare Advantage plan, you can even join a Medicare Advantage plan anew, but to switch between Medicare supplements, which are a popular product that work with original Medicare, you do have to answer health questions in most states. There are some states like New York, Connecticut, and Massachusetts in which you don't, but in the majority of states across the country, you must answer health questions to switch between what they call Medicare supplemental policies. This is where a lot of confusion comes around. People who have been able to switch their plan every year on individual health insurance under 64 then join Medicare and say, hey, I don't like my plan. I can switch it every year during the annual enrollment. If it's with a Medicare supplement, that's not true. You can't just switch every year because it's annual enrollment. You can switch if your health abides it. In the Medicare Advantage side of things, it's the complete opposite. You can switch your plan every single year without answering health questions. So our biggest differentials there between the individual enrollment period and the Medicare enrollment period, of course, the dates. The individual enrollment period starts later and ends later, and there's no health questions whatsoever. You join whatever plan you'd like. Whereas the Medicare annual enrollment period starts earlier, ends earlier, and if you're looking to switch between supplements, there will be health questions, if you're looking to switch between Advantage plans or drug plans, there'll be no health questions. So hopefully that helps for somebody who's maybe looking to join Medicare soon or had just joined Medicare recently on what the difference is between these enrollment periods and what your rights are. If you need to contact us, feel free to visit our website at njlifeandhealth.com. Call our office in Toms River, New Jersey at 848-226-6897. We'll be happy to help you out and walk you through an evaluation. Feel free to like, subscribe, leave us a comment below on questions you have, comments on the video, or if there's another video you'd like to see us do, and we'll see you in the next video.